In this film, we're asking how European health systems are responding to the pandemic. Dr. Josep Figueras joins me now. Dr. Figueras, you've developed a system to collect and organise up-to-date information from European countries. Can you tell me more about that system and what uses it might have for public health?
The health systems response monitor analyzes systematically the responses of the health systems to the COVID pandemic in the European countries. It allows for focused comparisons and identifying best practices in different countries of the region. But as importantly, what it does, it addresses key policy questions for member states, such as improving the testing and tracing, such as increasing public health capacity, such as introducing new digital health interventions that make have an impact on the effectiveness of the health system response.
And what can we learn about the resilience of health systems?
In effect, out of our research, we can come up with 6 major factors that explain the resilience of the health systems and therefore their effectiveness in addressing the pandemic. The first one is indeed the leadership and a good and transparent communication that builds the kind of trust that you need from the public to follow the guidelines, the lockdown procedures, and so on. The second, and very important as well, is the ability, the capacity to work across government departments. The intergovernmental cooperation is being fundamental. The third, very much into public health, is the public health capacity to have a good surveillance system to identify how the epidemic is moving, is developing. And secondly, that capacity to put in place fast and effectively a good testing and tracing mechanism. One very important one is those countries where they have already good universal health coverage systems with universal access to effective services. That's been very fundamental. And finally, we need to highlight the role of flexible delivery systems, the ability of countries to modify their primary care, their hospital services, introduce new pathways, and in particular, to use new digital health innovation measures to provide that access to the health services.
Thank you, Dr. Figueras. And joining us now, Dineke Zeegers Paget. Could you tell us, please, what trends you're seeing in the ways that European health systems are responding to the pandemic?
What we see in Europe is that there is collaboration between countries, but there's also national responses. So one country will focus on testing, whilst another country will focus on isolation measures. Over the past years, we have seen a disinvestment in health, and we have seen that because there were no infectious diseases or no big infectious diseases, the public health capacity has gone down in countries. And now we see that this poses a problem.
So what key lessons can be learned at this stage?
It is very important to work together, to exchange experiences, and to learn from each other's mistakes. What we also see is that we need an investment in health, and we need an investment in public health. It is essential that health stays high on the agenda, both at national and at European level.
Thank you both very much for joining us, and thank you for watching. Goodbye.